It's Shannon.
Hello, and welcome to Keeping It Real with Shannon Live.
It's Shannon.
Because you don't know how it's going to turn out.
It's Shannon. It's Shannon.
My kids empowered me to get out.
What's going on with this remote learning and in the midst of COVID?
Working for different elected officials, learning and understanding how to put the community first.
Hi, and welcome to Keeping It Real with Shannon. Thanks for joining us. And before we get started, I want to wish all the women a happy International Women's Day. And it was dedicated to uplifting women and honoring their achievements. It was born out of socialism, protests, and a fight for labor rights. So we want to salute all the great women today, and especially the women on the panel tonight, the great women, Allison Maurice and Dr. Vanessa. Well, Allison be cutting up rats for this vaccine y'all be taking.
Listen, no, we don't. All right,
and Dr. Vanessa, she's running around doing the also for the working with the health issues of women as well. But our special guest today is a woman who really needs to be celebrated. She has been doing excellent work in New York, and we're going to ask Dr. Vanessa to introduce our special guest.
Absolutely, without reservation. Our special guest today is Dr. Millicent Comrie. She's an OBGYN. She currently works at Maimonides Medical Center, where her specialized focus is on fibroids and abdominal myomectomies. She developed techniques that allow women to keep their uterus and not require hysterectomy. She is the medical doctor and founder of the Maimonides Brooklyn Health Center for Women's Health, and she also established the Fibroid Center at Maimonides Hospital. Let's welcome Dr. Comrie to the show.
Hello there, Dr. Comrie. How are you?
Fine, thank you.
Well,
Thanks
well,
to
we-
all the
well, you-
wonderful women, and thanks for that lovely introduction.
Yes.
Absolutely.
Well, you are definitely one of the women that need to be celebrated today on this national holiday because you've been doing such good work here in New York, in Jamaica, the West Indies. I mean, you're just all over the place. I don't know. We can't even keep up with you half the time. But I want everybody to know that she is really an excellent, great doctor. Have patience with you, answer all your questions. You have no problem. So we definitely want to welcome you to the show today to discuss some of the, women's health issues that we all face. There's so many of them. I mean, I was looking at all the things that we go through with heart disease, stroke, diabetes, maternal health, breast cancer. I'd like to do the one that I see now that just most look like it's just affecting us. We want to touch on is as much information we can get: heart disease, stroke, and the breast cancer. Because it seems like now it's more than ever that women are having strokes, getting breast cancer, having heart attacks. I mean, I know we probably don't take care of ourselves like we should. I'm an example of that because I was just in the hospital for a week because I was probably should have taken better care of myself. And that's the problem, that when we feel something wrong with our body, we don't go and get it checked out as soon as we should get it checked out. And then it ends up, making it worse than what it is. But why would you think that there's so much now with the heart, with your heart having heart problems and having strokes and stuff?
Well, I must tell you, first of all, I would be remiss if I didn't give a big salute to Lottie for the work she has been doing in the community and keeping us well informed and keeping the women all over Brooklyn, the whole area, totally up to date and on top of their health. As a matter of fact, as you just mentioned, when Lottie wanted to do this a week ago and she got sick, she was willing to do this from the hospital. I said, "You better get well first and don't tell me anything about you're there struggling and you want to be on a talk show." gasping for breath, and I just had to cut it down.
Yes.
So, when women don't take care of themselves, I must say that it's not because we don't know better. It's the multifaceted approach. It's the
Yeah.
multitasking. It's the 500 things that we have on our paper, and we like to think we accomplish them all and finish them all. So even that 1 week ago, she was willing to do it in the hospital, even when I was so glad that she went there and
Mm-hmm.
took care of herself for a change, putting herself first, and she
Mm-hmm.
still wanted to do the show there. So it's our commitment to what we have to do. It's the 500 things that we have on our list, and then we were taught that put yourself last and put people
Mm-hmm.
first. But we can't take it to the ridiculous or the grotesque, because in the long run we lose. We
Right.
know that I am never gonna underplay the role of men in the family and in our lives, but
Right.
here is what I know: the matriarchal influence is so vast that we have to take care of ourselves first, because we have to take care of our kids, we have to take care of our parents, we have to take care of our spouse, we have to take care of the people around us in our community, in our churches. Therefore, it follows that if
Right.
our health is not good, we cannot do all the things we have to do. Running, grabbing the breakfast on the run. So we're not eating properly. We're not taking time to exercise. We're not taking time sometimes even to go for our little checkup, the pap smears, the
Yeah. That's true.
EKGs, the little blood work to make sure that our cholesterol is not too high. These are the things we're so busy doing. So it's not like a lot of us are careless when we're going for the pap smears. We're bleeding, and we're in the menopause, and we know we're not supposed to bleed, but oh, I'll look about it next month, and next month becomes
Yeah.
the other month and the other month.
Mm-hmm.
Mm-hmm.
So that's our problem. We have to take
Mm-hmm.
care of ourselves first so we can be this person that everybody drags and holds on to and need.
Well, that's true, and as they said, when you're on a plane and anything goes on, the first thing they tell you to put your mask on first before you can help someone out. But to allude to what Lottie said, some of the women issues that we have today, we're finding more maternal deaths at this
Yeah.
stage today, which should not be, especially in the United States, and that's something that's not really readily talked about. But the maternal death is increasing among our Black and Brown community as well.
And here is the real reason. Then we talk about what's killing our women: heart attack.
Yes.
So
Yeah.
we're eating on the run, we're not
Yes.
eating the right foods,
Mm-hmm.
because we know that one of the reasons why we gain weight is because we all love the carbohydrates.
Yeah.
Yes.
Why do we love the
Don't we
carbohydrates?
love them?
Because the carbohydrates has the endorphin. So
Mm-hmm.
when a stress takes you, you reach for your piece of bread, or you eat your
Mm.
rice, and you eat a piece of cake, or you do the candy, the sweets, because
Right.
it's a comfort food. We're getting the endorphins from it.
Exactly.
But then
Exactly.
we get overweight.
Yes.
And when
Yes.
we get overweight and our cholesterol is high, we
Mm-hmm.
are at risk for stroke, so we get strokes. If we're not going for a checkup, how do we know that the
If
blood
something's
pressure
not
is
right.
high?
Yeah.
And when
Absolutely.
do we know the blood pressure is high? When we get a stroke, or when somebody forces us to go in to see the doctor, and the doctor say, "Oh, your pressure is high." I don't have high blood pressure. Yes, you do. You just
Yeah.
Mm-hmm.
never know. So what are
Yeah.
Right.
some of the signs of this high blood pressure? You get up in the morning and you feel a pain at the back of your head. That's one of the
Mm-hmm.
Right.
signs of the blood pressure. What
Oh.
And you have
Yeah.
to watch what you eat, the salty food. I am
Yes.
telling you, you
Mm-hmm.
have salt is the most abused
Yes.
ingredient.
Mm-hmm.
If you notice, some people, they're sitting at the table to eat. They don't even taste the food. They pick the salt up to
Pick
add
this and
salt.
yeah, and start putting
Yep.
salt in there.
Why
There's
are
some
we
Yeah.
sorts you
adding?
can't even hear.
Yeah,
Feels.
yeah.
Mm-hmm.
But there's something going on. It's almost like something is going on in the country because even now, if you go out to have dinner, their
Mhm.
food is so salty when you eat it,
Yes,
and it used to not be like that. So I don't even understand why the people in the restaurant is making the food so salty. Because I mean, I even had to ask the manager, like, "What is going on in here?" I used to come in here before the food wasn't salty like this, but all of a
but
sudden now, everywhere you go to eat, the food is so salty.
because we have to speak up. We have to say, may I speak to the person in charge? May I speak to the chef? And we have
Mhm.
to say these things because we're buying the food. And if they're not complying with our request, then we don't buy. And so they have to comply. It's the
Mhm.
salty food, it's the fatty food, it's the fact that
Yeah,
we're
Yes.
not taking time out to go for our annual exam for our blood pressure to be checked.
yeah,
A basic thing like a blood pressure cuff should just be in the house
yeah.
because every now and then you have to check that pressure even if you're on blood pressure medication, and they
Right,
make the automatic ones now that everybody can check their pressure. But here is the reason why we're seeing a lot now. It's not out of context. This pandemic has been
Mhm.
the most crippling, stifling,
Yes.
overwhelming,
Mhm.
overpowering, and all the synonyms you could ever find. And I've never seen any. One thing at this age, I really should be retired. But the
mhm.
pandemic makes me know that I don't know what I'm doing coming home to sit at home all day.
Because
Because
we've
Right,
this
already done
pan,
it.
right.
yes,
Yeah,
We've done
the
it.
right.
pandemic and staying at home makes you know that, oh, not me. But how can you say not me? As I always say, a dog of my age is no puppy.
Right.
Therefore, somebody like me should be really, I shouldn't be working still. I shouldn't be still doing deliveries. I am very comfortable to say in August I'll be 74. I should
Wow.
really not be even doing obstetrics. I did a delivery Sunday. So I am
Wow.
still doing deliveries. I'm still doing
Exactly.
surgeries.
Exactly.
Because I love it, but I can't go home. I
Great.
can't stay home. And people say, teach. I'm teaching every day now. So,
Yeah.
Mhm.
it's not like a new phenomenon that I would take on and get eager and excited about. I was doing that.
But
Right.
how do
But
you? But
I don't want us to underestimate the stress of this pandemic. And
yeah,
when we
Right.
carry the stress of our children and grandchildren, we
Mhm.
carry the stress of our partners struggling in these times to make things go. So, stress alone is bringing on these heart attacks.
Absolutely.
People are,
so
the doctor's schedule are reduced. So when you call and you don't have an appointment until October, you don't take it. But then October comes and you don't have one. So you pass another
right.
year, your heart is not checked, your blood pressure is not checked,
Right.
your blood
Yeah.
work is not checked.
So
You're
we're
not
gonna
doing your pap smear.
well hold that thought, Dr. Comrie. We're gonna take a quick break and we'll be right back.
It's Shannon. It's Shannon.
Get it, slip it, cuff it, check it. Talk to doctor now and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Hi, if you're just joining us with our special guest, Dr. Melissa Comrie, we're talking about women and their health. Now, before we went to break, Dr. Comrie, I have to, I mean, I hate to agree with what you said, but what you said is absolutely true because I tell you, when you grow up a certain way and you eat all kinds of food and stuff like that, and then, like you say, you start gaining the weight and whatever, you don't get control of the weight and stuff like that. So I'm here to tell the women today, especially young ones, you need to start doing what you need to do, before you get older, because after I ended up in the hospital and everything because of the breathing, and then after I got in there, then the pressure went up and they couldn't get the pressure down. And so then when I did my follow up earlier today, and the doctor said, "Oh, you can't eat any salt, you can't eat any carbs, all you can be doing is eating vegetables and the meat and fish and all that kind of stuff. You can't do this, you can't do that." I looked at that doctor and cried like a baby. She looking at me talking about, "What are you crying for?" I said, "Cause you sitting there telling me I
I can't
cannot
eat.
eat the food that I used to eat before.
Terrible.
I can't eat.
I
I'm gonna be
can't
on a
eat.
water diet.
I can't eat. If you want to live, then you better eat what I tell you to eat." So
What
I
is
just
that?
said
Water?
it's like hurtful when you hear this and you know it's the
Do
truth,
not do that.
but it's so hard, to just get disciplined until something really bad happened to you. Then you'll start getting disciplined.
But one of the things that I have to tell practitioners, when you have a patient that comes in and she's over 200 pounds and she has been eating like this all her life, and then you say you can't, you can't, you can't, you can't, it becomes so overwhelming and so impossible. When that patient leaves your office, you say, right, she's crazy. How can I? You have to start. Here's how I start: put the protein in your mouth first, then the vegetable, then the carbohydrate, and try to drink more water. Because the water and then the protein and the vegetables, you won't consume as much carbohydrates as you would had you gone straight to the rice with the gravy first or the bread with the butter. And then, people can't afford the gyms, like, because the prices are so high. So I say, just do anything, walk around your block, you're outside getting fresh air. Do that 20 to 30 minutes at least 3 times a week.
Mm-hmm.
Then, as you start to feel better, you'll add on a little more time, drink the water, do the exercise, protein, vegetable, and then the carbs,
Mm-hmm.
and
Oh,
just some little exercise. Don't go, you don't have to buy the 2,000, 3,000 machine, because most people buy them and don't use them.
Right.
mm-hmm.
And something
So
as simple as that they can do,
Mm-hmm.
get
basically.
outside and just do a little walking,
Mhm.
and you come back in and you'll feel well. But I want to stop here and go to the real problem. We have to start sooner. We have to be so careful what we give our children and grandchildren. We have to
Mm-hmm.
start
Right.
to work their diet. We have to make
Mm-hmm.
sure that we take them for their regular checkup so they know that it's the norm to be
Mhm.
doing this. We have to force our spouse, our partners, to go and get their little EKG. We have to get the
Mhm.
men to go check their prostate. You can't,
Yes.
and they say, "Oh, I don't want anybody putting their hand, blah blah blah. What is a one way versus a two-way?" Let the doctor check your prostate, men, and let
Right.
them do the PSA, so we know if we have something, because in the early stages of prostate cancer,
There are
it's
more
treatable
options.
and curable. Get your EKG, get your cholesterol, because if your cholesterol is high and you monitor it, then your blood vessels won't be so bad when you get older. Let our
Wow.
little teenagers go for their little checkup. Let them see their pediatricians, and when they get to 21, switch over to a primary care.
Mhm.
Dr.
Let
Carmen,
them, yeah.
Dr. Carmen, let me ask you a question because a lot of us don't know. How often should, and depending on the age group, how often should we be taking our children? Let's say 5 through 12.
Five
How
through 12.
uh-huh.
The pediatrician should see your child at the start of the flu season when they're going back to school.
Okay.
Then they can check them out, make sure they have the appropriate vaccination, and
Mm-hmm.
give them the course of what they have to do. You don't have to be taking them unless they're sick. You don't have to be doing
Gotcha.
that again until
School starts again.
Mhm.
Okay, so let's all right. So for our young tenderonies, our 20s, our 30s, and our 40s, that would be
yes.
me.
So
How often should we be going to the doctor?
the first pap smear is done at 21. Some younger girls are sexually active, and so they need to have the exam before 21, because
Okay.
then they have to be checked for the sexually transmitted diseases.
Diseases. Okay.
Because when they're sexually active and you're not checking them to check the discharge and to see that it's not chlamydia or gonorrhea, when our kids are in their 30s and get married, that's when we're finding out that both their fallopian tubes are blocked. And you know the fallopian tubes from your biology, it's the uterus, then the two things off to the side with the little finger, and then the ovaries. If the
Yeah.
fallopian tubes are blocked, then they are
That's
infertile. They
it.
can't have kids. Had they gotten the chlamydia, gonorrhea, and was treated appropriately, then they wouldn't have that. So they
Yeah.
do the first pap smear at 21. If they're sexually active, they have to be followed. Even if they're on the birth control pills, they should use a condom, because at this age, the guys are experimenting and the monogamous relationship barely exists. And therefore, you might think, oh, he's only seeing me. That's in your head a lot of the times. And when you're taking it for granted and don't use a condom, then the girls are getting the infection. And not every discharge is a yeast. It can be chlamydia, it can be gonorrhea. So it has to be checked. So the girls should get their checkup. Now, I know that the American College, they talk about when you start the pap smear, if you have 3 consecutive negative pap smears every year, you can start spacing out your pap smear to every 3 years. A
Okay.
lot of, and some people every 5 years. I don't believe in that,
Okay.
because in this era of the HPV, the human papilloma virus, that we can give the children the vaccine for, they suggest that we give the kids long before they start college. Some people say 11, 12, but because some of the kids are not even thinking about sexual relationship, some mothers are scared to do it at that age. But as my mother say, every woman knows when they watch, as my mother used to say, the cut of your jib to see what your movements look like. You know that carry this one in to go get the vaccine. When you start to see the little movements, as my mother say, according to movements, when you see
Mm-hmm.
these little movements, then you go get that child in to get the HPV, because the thing about the human papilloma virus is the fact that if you get that virus, and that's where you get the warts on the vagina and the cervix, you are at a high risk for cervical cancer. So therefore, you that's why they get the vaccine, and they're now even giving it to the boys. So when the kids come to me and they come at that little tender age when they're going off to college, a lot of the parents bring the kids in. I give them the little talk. And my baby is 45. And I remember at 16 saying, your vagina is your most private space. Nobody should invade that space just in a casual way. And I start to tell them about all the sexually transmitted diseases. And then I said, but if you're not listening to me and you're going to do that, then they get the condom talk. And don't be uncomfortable to tell them, because they're either not going to do it or they're going to do it. So make sure the lesson is taught.
Yeah. So
And then you have to tell them that. And you have to know that even if they're on the birth control pill, pregnancy is not the worst thing that could happen to them.
Right.
It's the syphilis, it's the gonorrhea, and it's the chlamydia that
Yep.
makes them infertile.
So, Dr. Comrie, we don't have a lot of time left until we go into the after show, but I do want to touch on the breast cancer because it seems like that's on the rise now. There's just so many women that's getting breast cancer. Why do you think that's happening? Is that goes back to the same thing we're eating, or there's something else going on in your body?
Okay. let's start with the family history. If
Right.
your mother, and the maternal influence is most important. If your mother, if your maternal grandmother, if your sister, if your mother's sister, your aunt, if they have a history of breast cancer, that's the alert already that this thing is lurking in the family.
Okay.
If your mother has breast cancer at 40 years old, bless you, your screening starts 10 years before that. So from 30,
Oh wow. Okay.
every patient that comes into my office, if she's 18 years old, if she's 20, if she's 40, is taught to do the self breast examination.
Mhm.
And the story goes like the right hand examines the left breast, the left hand examines the right breast, and see, Lady Maurice is showing you yes, hand is over the head. I like flat
Mhm.
on the back. I don't like the shower. I like flat on your back, and you're
Mhm.
going from under the armpit in a circular manner, feeling
Mhm.
for anything that feels like a pea, a nut, or an olive, and don't get nervous because a very common benign, meaning non-cancerous condition is fibrocystic breast. So you
Mhm.
will have a lot of women, especially if you do a lot of chocolate and sodas and tea and coffee, will tend to have fibrocystic breast. So I don't want everybody going tonight now feeling a little thing and jumping out of your skin. Oh my God, I have breast cancer. No, you will
No,
see that.
Right.
One thing
yeah,
that
but
tells you,
we're gonna have to cut this part of the show short because we're out of time. We'll pick up in our after show to finish talking about the breast cancer because I think that's very important. So we
Um,
want to thank you, Dr. Connery, for coming on
you're
the show
welcome.
tonight to give us some insight on some of the women history, health issues. And we want to say to all the women that might be watching, take care of yourself. Make sure you go get yourself checked. Look for any signs that may don't look right or you don't feel well. So thank you for joining us. And as always, we'll see you next time.
And
Thank
one
you.
quick
Today's show
flash.
is sponsored by Abu's Bakery. If you have a sweet tooth, stop by Abu's Bakery for some delicious cakes and pies.
It's Shannon. 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 Keeping it real. It's Shannon.
Hi. I hope you stuck around for the after show. We are talking to Dr. Melissa Comrie, medical doctor from Memon Minis Medical Center. Now, when you was talking about the examination, of your breast and stuff like that, the thing about it is, I mean, I know Allison was showing us what we're supposed to do and all that kind of stuff, but you know what it is? I never do that because I'm so scared to do it because I'm so scared I might find something. I just won't do it. I just can't bring myself to do it. I don't. I'm
We're
just
not
so
doing it,
afraid that I
Lottie.
might find something. I don't know what I might
But you
react
will
to.
want to find something.
I know I'm supposed to be doing it, so I would know there's something there, but I just can't bring myself to do it.
So when you
But
want to bring yourself
Lottie,
to do it at stage 5?
No, when I go to the doctor, let them
No,
check
no,
but
me.
no,
you don't go to the
no.
doctor every month. You don't wait to
Right.
go to the
I
doctor.
know,
This is your
I know, but
opportunity.
it's so hard just for me to, you know,
But
I don't know. I
Lottie,
guess it's the fear in my mind.
that's the thing. A fear, as my mom used to say, fear is for a child. Lottie, you have to check it because early
Yeah.
detection makes the difference between a quick
Yes.
lumpectomy.
Yep.
You may or may not even need chemotherapy or radiation therapy if you do it early. or you wait until it's there, it's now under the lymph nodes under
Yeah.
the armpit,
Mm.
and then it's
Yeah,
panorama.
proper. Yeah.
You
Then it's
have
a
to check it.
mastectomy. Then it's
Yes,
Well,
chemo.
there's more than a
yes,
mastectomy wants to get in the lymph nodes. It's become
Right.
yes.
metastatic, you know.
Yeah.
Mhm.
Then it
Yeah,
becomes chemotherapy.
Mhm.
and the likes. The other thing I wanted to say, not to divert from breast cancer, especially in the winter time with the snow. So you're shoveling the snow and you
Mhm.
feel a heaviness on your chest. You
Yeah.
feel as if something is sitting on your chest. Get right out of that snow and go inside. And if it persists, 911. So the
Oh.
signs of the heart attack, the heaviness on your chest, you feel as if somebody's sitting on your chest. The pain
Mhm.
is radiating down your left arm. The pain is radiating up your neck.
Mhm.
These are the signs, especially if
Oh.
you have cholesterol issues. Make some moves and quickly. Back
Mhm.
to the breast
Mhm.
cancer. You have to do the breast exam, and the last thing, you have to check the nipple for discharge, because if you
Mhm.
see like greenish bloody type discharge from the nipple, then it's the duct. You can have the cancer within the duct. So
Mhm.
beyond the feeling, you have to squeeze the nipple to see if you get a discharge. There is a
Mhm.
benign condition that will give you a milky discharge in the breast, but that doesn't mean cancer. Most time that's associated with um, that's when your prolactin is elevated and you might have a brain tumor called a pituitary adenoma.
Okay. Mhm.
Mhm.
So if you're having that milky discharge, but you can have it if you just had a baby, if you just had a miscarriage, if you're on some of the we call psychotropic drugs. A lot of the psychiatric drugs give you breast. So again, don't go and
Okay.
don't and get smart. Get to a doctor thing, or it's something we need to take a little further. Because and you have to do it even when you say, well, I just think about kids and your grandkids. So
So now the
yes.
other thing was is I noticed also too, because one of the ladies that I know at my granddaughter's school, she just suffered a stroke, and that seemed like it's on the rise too, with a lot of us having strokes and stuff. And I know they say most of the time the strokes come from where you stressed out, but is it always like stressed out? Because some people I think have strokes and it don't necessarily mean they're stressed about something.
Not
So
stressed if you have hypertensive
Right,
disease
it's a high blood
and
pressure.
you're not taking your medicine and your blood
Yes.
pressure goes up, you can get
Mhm.
a stroke.
yeah, but then why? So if you taking the blood pressure medicine and your
Mm-hmm.
pressure is still going up,
It
Well, a lot of these
means that
sometimes,
you go ahead.
right. It's either it could be either a couple of things. Either you're not complying with the medication, maybe the dose is wrong, maybe the class is wrong, and sometimes people
Mhm.
don't follow up and let the doctors know what's going on. And that's why you have different classes and doses of medication. And when people are newly diagnosed, they do like a trial and error to see what their
Yes.
body's compliant with.
What
So
is the
they need
therapeutic dose? They have to
exactly.
figure those
They need
things
to let
out.
the doctor know what's working for them and what's not working for them. And they need to, just like Dr. Comrie said, they have to be able to check their pressure at home, especially if they're newly onset diagnosed. They need to know what it is and keep a journal of what it is, because
Yeah.
maybe that
is
class and dose is wrong.
Dr. Carmen, is it? I mean, is it good to be on two, three blood pressure medicines at the same time?
If that's what it takes to control you.
Mhm.
But I will tell you that there are some of these antihypertensive medication that works better in blacks. And so you have to go to a doctor that is knowledgeable in the different classes. So he or she picks the one that's better
Mhm.
for you. And that's another thing that overwhelms a lot of patients who are hypertensive. Once they start getting to this, oh, I'm not taking all these medicine, and they might pick one or two.
Mhm.
Yep.
You have to go back to the doctor and say, don't want to be taking all the medication, let the doctor decide what you take or not take. And
because she doesn't want to take her high blood pressure medicine, but she gets the headaches and the pressure. But
oh,
it's like
that
some
is the
people feel that they don't need to take the pill because they don't want to
No,
get
but
stuck on
Dottie,
the pill.
but you know what? Sometime too, there's pills where instead of like 3 or 5 pills, you may have anti-hypertension medication that is in combo, right? That you can have 2 and 3 different type of medications to one. So some people don't want to be running to the bathroom taking a water pill with the hydrochlorothiazide and things like that, but their body may be retaining water. Or you got some other classes that are like ACE inhibitors, right? They're nephroprotective, but it's a good medication, but the side effect of it is cough. So sometimes people they may not know it could be irritating here and there, but you just like Dr. Cameron said, you just can't just ignore and stop taking and pick and choose what you want to take because
Right.
if you don't take it in combination, it's not going to work in part.
Right. And some of these medications you can't just stop taking. You have to
Exactly.
be weaned off and things like that, like, NSAIDs and steroids and things like that. Yeah, there has to be a gradual kind of pilfer off of these things. So, people don't really understand, the damage that they can be doing on and off, on and off, on and off, or, trying to be at home doctors. It's not helpful.
And also too, it's like a real concern too. Like when you take so much of this medicine, I mean, to me, the medicine is what's killing you because it's killing your organs and everything. So, I mean, I know you say we have to take the medicine, we have to take, but
Right.
sometimes when I think about it, like it's
no, but
bad
if
both ways because I know the medicine is messing up your organs.
But let me
Listen,
ask you something.
how
Let
you
me
get there in the
something.
first place?
But wait, but let me ask you something. If you don't take the medication, what are you doing? Are
what
you
Killing yourself.
how are you eating? Are you exercising? Are you eating certain food? Are you growing your own foods? What are you drinking? What about the sedentary lifestyle? Your exposure? Are you eating out? What are you doing to compensate if you don't want
Right.
to take the medication?
Right.
Some
Because there's
families,
a reason why you needed the medication in the first
exactly.
place,
Some
because you
families
weren't doing what you're supposed to do.
right. Some families can't afford to make 2 pots, one for me, one for the kids. So what happened? They do when Dr. Cameron mentioned women tend to sacrifice themselves. They sacrifice themselves for their family. So they're gonna cook
Yeah.
one pot that's affordable. So you have
Right.
to be able to pick and choose and decide, what you're gonna do in lieu of that.
Mm-hmm.
and one of the biggest thing that you can do to help this blood pressure is to lose some of that weight. A
Absolutely.
lot of people get marked reduction in their antihypertensive medication by just taking off some of that weight.
Yeah.
And don't look at it as, oh, my doctor said I need to lose 90 pounds. That's too overwhelming.
Yeah,
One
that's a
I
big
know.
at
number.
a time.
I know because my doctor told me the reason I couldn't breathe is because I was overweight. So I told him, well, I said, well, there's fat people bigger than I am that can breathe. So I know that can't be the problem why I can't
Talk
breathe
Well,
about it.
because
thank
they tell you
thank God
all
for
kind of
the
stuff.
wisdom, because you could
Mhm.
have that situation could have been very, very
Right.
miserable.
Mhm. Yes.
So, and
Yeah.
that's the other
Well, no,
thing.
well, that's what I'm saying.
People
That was only because
people
I took it upon myself to just take charge of myself and do what I had to do rather than sitting there listening to her telling me that I'm overweight. That's why I can't breathe.
and that's
But
one of the problems. People hate fat so much that they don't have the patience to work with people who gain the weight. They just
right.
have this negative attitude, and
Mhm.
everything is about the fat when there are so many other things beyond the fat. So don't listen to that level of
Hmm.
madness.
And
You
also
have
too, that BMI, that kind of weight to height ratio,
Mhm.
that's a European standard.
Yes, it is.
That's a European standard. I'll tell you that at my fittest, I was 5'10" and 180 pounds, and I had a doctor tell me I needed to lose weight. And I was like, I play soccer. We have practice every day. I swim and I work out at the gym 2 hours a day. What am I not doing? Let me know. Let me know. Let me know what I'm not doing. And I was fit. We were running a field every day, 6 o'clock in the morning, 4 p.m. in the afternoon, every day, Monday through Saturday.
Wait on sometimes those things, like you said, a lot of standards and medication and research is based on a European culture. So
Right.
it puts our black and brown community at a disadvantage where we don't have
Absolutely.
things specifically, curtailed to us. specifically.
But
So that's
Mhm.
another
but
part.
since you mentioned that, let me
Mhm.
sidebar. We also don't go for those research projects neither. So it's a
And that's
double-edged sword.
it's a double-edged sword, and we know that the historical component to it is, and that's the fabric of this country. Well, I'm in
Mm-hmm.
Panama, but right now, the U.S. But it is what it is, and sometimes we have to be able to educate ourselves, get informed. Talk
Mm-hmm.
to your doctor. Sometimes you may need to get to a doctor that looks like you for the cultural component to it, if you feel more comfortable in that sense. Look at
Yeah.
Dr. Camry. She's out there doing things that fibroids, things that women don't think about, or they think that they have, or they automatically getting hysterectomies. And she created techniques where you don't have to get hysterectomy. And sometimes you got to dig in and navigate through the trenches to find out these type of doctors, who's on the forefront and doing these things and bringing this knowledge into the community that's keeping us from getting these surgeries,
Yeah.
unnecessary surgeries at
Yeah.
times.
Yeah.
Absolutely.
Yeah. That's true. Yeah.
Mhm.
Well, Dr. Comrie, what's your wrap up words? We're going to go. We certainly enjoyed talking about our women issues. So, what would your last words to women that may still be on listening?
My
Uh,
last word to women: take care of yourself. Put that
Mhm.
oxygen mask on your face first,
Mhm.
and then you will be well to take care of
Others.
all the other people around you. Because
Right.
once you are well, then the
Mhm.
rest of your family can
Is
be
well.
well. The oxygen
mhm.
Absolutely.
mask, because the burden for us is a lot. And when the family is stressed, we are stressed.
We are
And when
stressed.
the family is stressed, then we eat more, we stress more, we gain the weight, and when we want to lose the weight. Love yourself first. Be
Mhm.
solid in bringing up our kids. Make
Mhm.
sure with the girls, you give them that positive energy so they speak back, so they
Mhm.
can speak and absolutely say what they want, speak for
Mhm.
themselves, because an education, education,
Education.
education.
Education. Yes. Yes. Well,
That's
thank you.
that's
Thank
the
Thank you so
word.
much for coming on and talking to us. This has been very informative. I asked for prayer to help me.
you.
Yes, yes.
We praying for you, Lottie.
y'all, y'all just pray for me to help me get this little weight off my hips and butt and stuff, so
But
I'll be able to
Lottie,
breathe.
but Lottie, that has always been you, and you're such a good soul that God always make you see how you walk to that hospital. He made you make that walk under those circumstances because you're a good person at heart, and so you're taken care of. But one day at a time. Don't try to see the whole thing coming off. Slowly.
Mm-hmm.
The other thing is 6 to 8 glasses of water. Drink your water so you're full to begin with, yes,
Yes.
and then it will be less space for the junk. But we're
Yes,
praying for you. We love you. You have to be here to educate. And you see, when you're doing the wrong thing, the thing is, you know when it's wrong, and you have that good common sense base that leads you in the right direction. And we're thankful for that
thank
because
you,
that has been your guide. God bless you
thank
all. And
you,
it was such a
Thank
nice,
you.
thank you.
comfortable. This foursome was very comfortable and it was a nice group. Thank
Yes,
you
thank
all
you so
so
much
much.
for
Thank
coming,
you. Thank
and
you.
we hope you'll come back again and talk with us some more. With some of our other issues going on. And before I go, because this is Women History Month, I just want to let the women. I mean, men can come too, but if any women are still watching, we are having my Bed Style Lions Club. We are doing a ladies' afternoon tea on March 26th. And if you're interested in coming or getting tickets, give me a call or email me for further information. It's really going to be a nice event. Women are coming together. We're going to get empowered. We're going to learn about being successful, about building wealth, legacy for our family. We're going to have some entertainment. We're going to be sipping tea and eating. We're going to have a good time on that afternoon, March 26th at 1 o'clock p.m. So if you want to come, call me for tickets or email. So thank you for coming on.
All
And
right.
as always, we'll see you next time.
All
Take
right.
care.
Bye. Bye.